irresponsible and lax immigration enforcement under the Obama administration was the rise of the sanctuary jurisdiction. Sanctuary jurisdictions nationwide continually refuse to cooperate with ICE and actively violate or disregard federal law. This committee has repeatedly delved into the complex issues surrounding these practices, but the problem persists and is becoming endemic among many metropolitan communities. For several Congresses, we have heard countless stories of sanctuary practices and the havoc they wreak on public safety, national security, and the sanctity of the rule of law in this country. Unfortunately, little has changed even with the change of administrations. Instead of working with the federal government, specifically ICE, to create a framework for cooperation, these jurisdictions have chosen to dig in deeper. Last year's announcement by San Francisco that the city would no longer participate in the Joint Terrorism Task Force for fear of coming into contact with immigration issues has only been exacerbated by audacious state policies. In 2017, the states of Illinois and California passed legislation that will tremendously limit the ability of state and local law enforcement agencies from working with or even contacting ICE. While the long-term effects of the framework have yet to be truly realized, these laws will absolutely have far-reaching impacts on public safety and ultimately constitutional law. While this committee continues to work toward an end to sanctuary practices and a reinstatement of immigration enforcement nationwide, we cannot forget a largely ignored consequence of these ill-conceived policies. In many of these communities, local law enforcement agencies that have traditionally enjoyed strong professional relationship with federal law enforcement partners are being forced, through no fault of their own, to dissolve those relationships. This hearing focuses on the continual fight against the opioid epidemic that is raging in this country. We're not here to discuss the underlying causes of the epidemic, and to be sure, this committee is not asserting that sanctuary policies have caused such an epidemic. But the fight against opioids at the law enforcement level has, as asserted by our witnesses' written testimony, greatly relied on strong federal partnerships, including partnerships with ICE. The crimes associated with the opioid crisis, including drug trafficking and violent felonies, require coordination, cooperation, and most importantly, communication. Nowhere in this is this more clearly demonstrated than in Denver, Colorado. At a time when drug crimes are soaring in the city, Denver has made a policy decision to not work with ICE and to make a poor distinction that immigration enforcement is unrelated to law enforcement activities. While the correlation between the two is incontrovertible, Denver is following the lead of many other cities and threatening those law enforcement officers that would violate such a policy. These practices not only fail to recognize the benefit of strong cooperation, but also fail to see just how closely immigration enforcement and drug enforcement are connected. With the influx of narcotics smuggling, especially in opioids, through our porous borders, it is often the tools of immigration enforcement that provide best practices to interdict and dismantle those operations. Just this week, Fox News reported that an alien deported 3 times was arrested in Florida for the intent to distribute over $400,000 of methamphetamine. Our public safety and our public health are tied to eradicating opioids, which can never be accomplished when the force multiplier that is ICE is sidelined based on political expediency and grandstanding. I want to thank Congressman Buck for bringing this issue to the foreground and for suggesting this important hearing. I also want to thank all the witnesses for being here today, and I look forward to this discussion. The time for Congress to act on sanctuary policies is long overdue, but I am confident that placing a continued focus on this issue will assist in the eventual reversal of such dangerous policies and practices. I now recognize our ranking member, Ms. Lofgren of California, for her opening statement.
Today's hearing asks us to examine